Hey guys, welcome to my channel, Not Just a Medico. I am back with the most requested video of important questions of general medicine. In this video, you'll get all the important and frequently repeated questions from your previous year question papers. And I can assure you that by preparing for these questions thoroughly, you'll not just pass but you can easily score distinction in this subject. Before beginning with the video, I'm gonna tell you that here the questions are given chapter wise for your easy understanding, and I'm gonna dictate all the questions because there might be few printing mistakes or there might be few repeated questions. So I would suggest you guys to write down all the questions without skipping the video. Now without any further delay, let's begin. Okay, now beginning from the first chapter of this subject, as you can see there, this chapter contains several topics including infection, effects of infection on body, its pathology, source and spread of infection, vaccinations, general infections, rashes and infection, food poisoning, gastroenteritis, sexually transmitted diseases, etc. I'll not read out all the topics of each chapter, but you can check out the headings for your reference. Coming to the important 10-mark questions, from this chapter you have only one important 10-mark question, that is, describe the infections from head to toe and causes of infection, describe in brief about empyema. Now moving on to the important 5-mark questions. The first one, source and spread of infection. Second one, malaria. Third one, management of syphilis. Fourth one, write in detail about the source and spread of infection. Yes, this question is repeated again, so you can just mark it out as a frequently repeated question. The next question is about HIV. What is HIV? Its prevention, management, structure, and a brief description. So these were the important 5-mark questions. Now moving on to the important 3-mark questions. Name 2 laboratory tests to diagnose HIV. Name 2 opportunistic infections in HIV. Modes and routes of transmission of HIV infection. 2 antiviral drugs. Enumerate 4 vaccine preventable disease. Name sexually transmitted diseases. Name vaccine in current clinical use. Stages of syphilis and name the lesions in each stage. HIV. And the last one, MMR vaccine. So this was all about this chapter. Now moving on to the next chapter. You can check out the topics in the heading to know which chapter I am talking about. So in this chapter there are no 10-mark questions. Moving on to the 5 marks. It's mainly about OP poisoning. Coming to the important 3-mark questions. The first one, enumerate 4 drugs of misuse. Second one, define food poisoning. And this was all about this chapter. Now moving on to the next chapter. In this, the important 10-mark question is classify obesity and add a note on management in obesity. Important 5-mark questions. The first one, causes and complications of obesity, clinical features and treatment of obesity, types of obesity, and you can simply get the question as obesity. So you can see the number of times this topic has repeated. So you must know that this is the very important topic in this chapter. Now the next question, rickets. Write a note on management of obesity again. Define obesity and mention complications. Protein energy malnutrition. The next one, kwashiorkor. Coming to the important 3-mark questions. First one, kwashiorkor. Second one, beriberi. Third one, marasmus. Fourth one, anorexia nervosa. Fifth one, evaluation of BMI. And sixth one, types of obesity. And there are 2 more important 5-mark questions from this chapter, that is clinical features and management of vitamin A deficiency. Second one, scurvy. And this was all about this chapter. Now moving on to the next chapter. This chapter includes all the endocrine diseases. In this, the important 10-mark questions are the first one, define hypothyroidism, describe the formation of thyroid hormone, its clinical features, and management of hypothyroidism. Second one, what is diabetes mellitus? Write about classification, clinical features, and management of the same. Third one, again about diabetes mellitus. In this, you have to elaborate the difference between the type 1 and type 2. Along with that, clinical features, investigation, pathogenesis, etiology, and management. Now, moving on to the important 5-mark questions. First one, clinical features of endocrine disorders, chronic complications of diabetes mellitus, goiter, clinical features of hyperthyroidism, treatment of diabetes mellitus, types of insulin and its side effects, Mechanism of formation of thyroid hormone, Cushing syndrome. This was about 5 marks. Now, important 3-mark questions are: first one, clinical features of hypothyroidism. Second one, what is hypoglycemia? Write its causes and name 4 hypoglycemic agents. Name 4 hypoglycemic agents again as a separate question. Complications of diabetes. 4 precautions to be taken in diabetic food. And there are 2 more important 5-mark questions. First one, hypoglycemia. Second one, management of diabetic ketoacidosis. And moving on to the next chapter, that is diseases of blood. In this, the important 10-mark questions are: the first one, define anemia, mention the etiology, clinical features, and management of microcytic hypochromic anemia. Second one, define and classify anemia and discuss the causes, clinical features, and management of iron deficiency anemia. The next one, explain the causes, clinical features, complications, and management of hemophilia. Moving on to the important 5-mark questions. First one, causes of iron deficiency anemia. Second one, define and classify anemia and write about iron deficiency anemia. By this time, you must understand that iron deficiency anemia is very important topic from this chapter. And the remaining 5-mark questions are also from the same topic, as you can see. Moving on to the important 3-mark questions. There's only one important question, that is causes of megaloblastic anemia. And at this point, you can see that this chapter is very important because most of the questions are coming for 5 or 10 marks. Coming to the next chapter, that is diseases of digestive system. In this, the important 10-mark question is: mention in detail about the causes, pathology, clinical features, and management of hepatitis B. Next important 5 marks: Wilson disease, treatment for food poisoning, causes of upper GI bleed, acute cholecystitis, gastroenteritis, acute pancreatitis. Mention different causes of upper GI bleeding, viral hepatitis, pancreatitis, ulcerative colitis. Moving on to the important 3-mark questions. First one, 2 causes of acute pancreatitis. As you can see, I have written a mnemonic there. I get smashed. This is a mnemonic for remembering the causes of acute pancreatitis. Yes, this is how I read. And always remember, guys, smart work is the key. Personally, I feel that mnemonics helps me a lot in time management during exams. It saves my time from sitting and thinking in the exam hall that if am I missing any point, or is there any cause or clinical feature that I'm missing out. So yeah, I would suggest you guys to use this trick, and you can get lots of mnemonics for various topics from ChatGPT. Okay, now moving on to the next question. Viral test, definition of Wilson disease, types of gallbladder stones, viral hepatitis, causes of dysphagia, liver function test, mention risk factors for esophageal carcinoma, clinical features of Crohn's disease, causes of GI bleeding, calcium channel blockers. And yeah, that's all about this chapter. Now, moving on to the next chapter, that is cardiovascular diseases. Important 10-mark questions are: first one, define hypertension, discuss the classification and complications of hypertension. Second one, definition, clinical features, and management of congestive cardiac failure. Next one, describe etiology, clinical features, and management of endocarditis. Next one, classify hypertension and add a note on clinical features and its management. The next one, describe in detail causes, classification, assessment, and management of hypertension. Now coming to the 5-mark questions. First one, rheumatic fever, Berger disease, achalasia cardia, pericarditis, cardiac arrest, complications of hypertension, myocarditis, varicose veins, infective endocarditis, its prophylaxis, causes of secondary hypertension, management of heart failure, John's criteria for rheumatic fever, cardiopulmonary resuscitation, Raynaud's disease, define cyanosis and mention its causes, management of DVT, management of hypertension, endocarditis. Moving on to the important 3-mark questions. John's criteria for rheumatic fever, achalasia cardia, vasomotor disorders, myocarditis, mention risk factors of esophageal carcinoma, mention causes for pedal edema, cyanosis, tetralogy of Fallot, two causes of congenital acyanotic heart diseases, enzymes in diagnosis of myocardial infarction, mention four causes of DVT, grades of clubbing, cardiac arrest, define cardiac failure and write about the causes of cardiac failure. What is cardiac arrest and write a note on CPR. And this chapter doesn't end here. There are many more questions. Now coming to the important 10 mark questions again. Define and classify hypertension. Write a note on its clinical feature, complications and management. Etiology, clinical features, complications and management of endocarditis. Classify congenital heart diseases. Explain tetralogy of Fallot in detail. Moving on to the important 5 mark questions. And before that, let me tell you all that this chapter is very important, you guys. As you can see, there are many questions from this chapter. So do not miss any of the question. Now moving on to 5 marks. First one, what is atherosclerosis? Write about the pathophysiology and complication. Pathophysiology of atherosclerosis. Define cyanosis. Explain the types and its management. Explain briefly about patent ductus arteriosus. Add a note on Jones criteria for diagnosis of acute rheumatic fever. Clinical features of hypertension. As you can see, there are many repeated questions, so need not to worry. Once you start studying, you'll feel that this is the very easy subject and it's very easy to get distinction in this subject. Now, next one, types of cardiac murmurs, atherosclerosis. Now, important 3 mark questions. What is unstable angina? Mention the drugs used for unstable angina. DVT and its prevention. Define bronchiectasis and its types. Jones criteria for rheumatic fever. Vidal test. Cardiac failure. Now there are few more important 5 mark questions. In that, the first one, rheumatic fever, Buerger's disease, achalasia cardia, pericarditis, Fallott's tetralogy, brief about hepatic carcinoma, clinical features of stable angina. And finally, we have come to an end of this chapter. Now, moving on to the one more important and vast chapter that includes respiratory diseases. In this, the important 10 mark questions are: first one, definition, etiopathogenesis, clinical features and management of pulmonary tuberculosis. Next one, define bronchiectasis, write about etiology, clinical features and management of the same. Second one, define bronchial asthma, write a note on its clinical feature, complications and management. Discuss etiology, pathology, clinical features and management of COPD. Define asthma, mention the types of asthma and write a note on its clinical feature and management. Now coming to the important 5 mark questions. Difference between extrinsic and intrinsic asthma, respiratory failure, pericarditis, emphysema, antitubercular drugs, tetralogy of Fallot, blue botar and pink puffer, management of bronchial asthma, clinical features and management of lung abscess. Coming to the 3 mark questions. First one, Mantoux test, types of bronchiectasis, respiratory acidosis, bronchiectasis, mention 2 respiratory diseases in healthcare workers and its prevention. 2 causes of suppurative lung diseases, define bronchial asthma, name 2 bronchodilators, name any 2 occupational lung diseases, 2 causes of transudative types of pleural effusion, classification of pneumothorax, 2 effects of smoking on respiratory system, 2 organisms causing ventilator acquired pneumonia. And continuation of 3 mark questions. Universal precautions by healthcare professionals to prevent spread of respiratory viral infections. Write about blue botar and pink puffer. Write the grades of dyspnea, mention 2 causes. Respiratory acidosis with example. Define lung abscess. Types of dyspnea. Name any 3 drugs used to treat bronchospasm and inflammation. Now coming back to 10 mark questions. Definition, types, etiology, pathogenesis, clinical features and management of pneumonia. Now coming back to the important 5 marks. Definition, classification, clinical features and management of respiratory failure. What is tuberculosis? Write the causes, signs, symptoms and complications. What are the types of emphysema? Write the signs and symptoms of the same. Explain the signs and symptoms and management of tuberculosis. Clinical features of COPD. Acute respiratory distress syndrome. Classification and management of pneumonia. Clinical features and management of bronchiectasis. Now, there is one more important 10-mark question, that is, what is PFT and what are the indications and contraindications of PFT? How do you differentiate between obstructive and restrictive lung disorders based on PFT? And the last important 5-mark question, that is, differentiate between extrinsic and intrinsic asthma. And there are few more important 3-mark questions from this chapter. First one, Mantoux test. Second one, types of bronchiectasis. Third one, name first line anti-tubercular drugs. And finally, we are done with this vast and important chapter. Now let's move on to the small chapter, that is diseases of skin. In this, there are no 10-mark questions. Coming to the 5-mark questions. First one, clinical features and management of leprosy. Second one, psoriasis and its management. Third one, dermatitis. Moving on to the 3-mark questions. First one, acne vulgaris. Second one, psoriasis. Third one, leprosy. Fourth one, dermatitis. Fifth one, clinical features of dermatitis. That's all about this chapter. Moving on to the next chapter, that is pediatrics. In this, there is only one important 10-mark question, that is, discuss cerebral palsy under definition, classification, clinical features, and management. Next, important 5-mark questions. First one, spina bifida. Second one, epilepsy. Third one, again it is repeated. Next one, clinical features of DMD. What are the problems of high risk infants and how to manage these problems? Types, clinical features, and management of cerebral palsy. Coming to the important 3-mark questions, define aneurysm, gout, 4 causes of developmental delay, osteomalacia, enumerate 4 vaccine preventable diseases, enumerate 4 problems of low weight baby, clinical features of autism, polio vaccine, low birth weight infant problems, this is the repeated one, dementia, autism, again repeated, BCG vaccine, causes of developmental delay. And yes, we are done with this chapter. Now, we are only left with the last and very small chapter. Before beginning that chapter, I would like to know from you guys if there are any difficulties in understanding my pronunciation or understanding these questions. Please feel free to drop your queries in the comments below and I'll try to answer all your comments. Now, moving on to the last chapter. In this, there are no 10-mark questions. Coming to the important 5-mark questions. The first one, anxiety disorders, its classification, management, and clinical features. Second one, schizophrenia, and important 3-mark question. In this, there is only one question, that is dementia. And finally, we have come to an end of this video. If you find this video helpful, then don't forget to like, share, and subscribe to my channel. I'll see you guys in the next video. Till then, take care and bye-bye.